Welcome to our YouTube channel. Today we are going to address a topic of great importance to everyone, tooth decay. Cavities are a common but preventable disease that affects people of all ages. In this video, we will provide you with detailed information about what cavities are, how they form and, most importantly, how to prevent them. We will also discuss the symptoms to look out for and the treatment options available. So get ready to gain valuable knowledge that will help you maintain a healthy, radiant smile. Start. Tooth decay is a common dental disease that affects people of all ages. They occur as a result of the breakdown of the hard tissues of the tooth due to bacterial activity. Cavities are mainly formed due to the interaction between teeth, bacteria present in the mouth and the food we eat. The mouth contains a wide variety of bacteria, including Streptococcus mutans, which is the main causative agent of cavities. These bacteria feed on the sugars and starches present in food and produce acids that erode tooth enamel. Tooth enamel is the hard, protective outer layer of teeth. When bacterial acids erode the enamel, a small opening or cavity forms in the tooth, known as cavities. If left untreated, decay can grow and affect the deeper layers of the tooth, such as dentin and dental pulp. Cavities can present a variety of symptoms depending on their severity. In the initial stages, no visible symptoms may manifest, but as decay progresses, signs such as tooth sensitivity to heat, cold, or sweet foods, toothache, enamel discoloration, and bad breath may appear. In more severe cases, cavities can lead to infection of the dental pulp, which can cause severe pain and require root canal treatment or, in extreme cases, tooth extraction. Prevention is essential in the fight against tooth decay. Here are some practices and measures that can help prevent cavities from forming. Regular brushing. It is important to brush your teeth at least twice a day with toothpaste that contains fluoride. Proper brushing helps remove dental plaque and bacteria that can cause cavities. Flossing. Flossing should be used daily to clean the interdental spaces and remove plaque and food debris that brushing cannot reach. Balanced diet. Limiting the consumption of sugary foods and drinks can reduce the risk of tooth decay. Bacteria feed on sugars present in food, which produces acids that damage teeth. It is important to opt for healthy foods and drink water instead of sugary drinks. Fluoride. Fluoride is a substance that helps strengthen tooth enamel and prevent cavities from forming. It can be found in toothpastes, mouthwashes, and fluoridated drinking water. Using fluoride dental products and drinking fluoridated water can be beneficial for dental health. Regular visits to the dentist. Regular dental checkups can detect and treat cavities in early stages. In addition, dentists can perform professional cleanings to remove accumulated plaque and tartar, reducing the risk of developing cavities. In case a cavity develops, the treatment will depend on the severity of it. Treatment options include removing decayed tissue and placing a dental restoration, such as a filling or crown, to restore tooth shape and function. In conclusion, tooth decay is a common concern but controllable if proper measures are taken. Remember to maintain good oral hygiene by brushing your teeth at least twice a day and flossing daily. In addition, limit the consumption of sugary foods and drinks and make regular visits to the dentist for professional checkups and cleanings. Prevention is key to avoiding cavities and maintaining optimal oral health. We hope this video was informative and useful for you. If you liked it, don't forget to like it and subscribe to our channel for more health-related content. If you have any questions or comments, leave them below and we will be happy to answer. Thanks for seeing us and see you next time.